All right, everyone. We'll get started. It's 4 p.m. and we are very excited to have another session of BrainX Community Live. This is for November 2025, and we have a very exciting speaker, Dr. Ashish Atreja, speaking to us today about a very, very exciting platform that he has recently launched. But before that, I do see a lot of new faces. So I just want to introduce them to BrainX community. Welcome, first of all. We started this community around 7 years ago with the idea that we need to have a platform for machine learning or AI in healthcare for good. Have had a very successful journey with now 7,000 plus global members. We have a very active LinkedIn group with 3,000 plus members uh, just on our LinkedIn, where we share a lot of scientific information. Of course, we have our website, brainxai.org, that is the repository of a lot of information. And then we do these live monthly sessions featuring the work, the research work or development work of many from across the world. So if you go to our webpage, what you will find is the latest updates and all the different sections. Once again, it's brainxai.org or brainxcommunity.com. We have the Connect segment where we house all the information related to these monthly live sessions. So you can see what's coming up, or if you missed it, you can get the information about the last one or the prior ones. And even if you missed it, don't worry. Please subscribe to our YouTube channel. It goes with the same name as BrainX Community, and you can watch the videos or the video recordings for the prior sessions. As I mentioned, we have a very active LinkedIn group. We share a lot of publications, conference opportunities, other information on there. So you should stay connected through this LinkedIn group so that you can stay up to date with all the latest and the greatest that's happening with AI in healthcare world. We have our Learn section through our website where you'll find a curated list of publications, because these days there are so many research publications that are getting published every single day in this field. We provide this curated links. You can filter them by the specialty of your choice, and they're categorized over there, and you can read these featured ones. If you're looking for data for your work, your research work, or for modeling, then we provide the largest repository of links to open source datasets. 200 plus open source datasets, which require minimal DUA. You will find the links and the description of brief description of these datasets right off our website. Once again, you can filter these dataset options by the healthcare specialty of your choice. And of course, these days, generative AI and large language model datasets have also been shared. So those are also available through our website. We have our podcast series, and we have featured Dr. Ashish Atreja in the past. And that is an exciting way to learn about people's journeys, researchers, developers, experts in this area, and learn from them and see how you want to shape your future in this field. Meetings and conferences. So everybody's looking for ways to connect, learn more. And in our conference section, we feature some of the upcoming conferences. So you can just go to the conference section and see which are the upcoming conferences. And hopefully we can connect over there. And hopefully you can feature your work at these conferences too. Some of the books that we have worked on with members of this community in the past, which might help and you might find interesting. So with that, I'm going to welcome Dr. Ashish Atreja, my close friend, with his latest venture called GenServe.AI. He's an amazing physician executive and AI innovation leader. I'm not going to read through this, but he has an exceptional past, also famously called as the app doctor. So Ashish, I'm going to hand it over to you for the presentation. Thank you for joining today.
Piyush, thank you so much for having me. It's a pleasure to be here. And Piyush and I go a long way. We were actually co-residents at Cleveland Clinic way back when, 2003, in the 2001 to 2003. He took the better path. He became an anesthesiologist. I took the dirty path. I became a gastroenterologist. So that's why I'm still working to recuperate from that decision of mine. And It's just, in fact, today we're presenting something. We work with BrainX at the American Medical Informatics Association Summit. So it's a full circle, and AI is actually becoming the bridge between anesthesia and gastroenterology here. Talk about something that I've been working for last couple of years, and that's now coming to a fruition. Is the initiative and a startup called GenServe.AI, and it's coming from the gap I really felt as the CIO and Chief Digital Health Officer at UC Davis Health, and many of my peer CIOs felt. 2 years ago, when like 6, 9 months after OpenAI came, it was pretty clear to us. It's a game changer for what healthcare is going to have. This kind of technology we had never seen before. And I've been working in AI or AI applications since 2001, 2002. My first random forest model paper was at that time. But I feel this generative AI is completely different than predictive AI, um, or at least is so much brings so much more capability at the consumer level that we can do so much. But at the same time, I feel it's like fire. When fire came as a revolutionary technology, not FHIR fire, but FIRE fire, humans did not know what to do with it, right? So many times it would cause burns and other things. Till we learned how to control that technology, then now it is in a very controlled manner we can use within our kitchen for our own purpose. So I feel we have to learn the art and the science of managing this technology. So 2 years ago, we created this largest consortia in generative AI called Valid AI. And we put a position paper last year in New England Journal of Medicine AI, talking about how we need to build capability across health systems. And health systems need to become implementation science centers, because most of the variability is not at the model stage or the creation stage. 80% of variation is, now it's disputable, but I will give my spiel there. I feel is at the deployment stage and delivery stage, because the workflow, who really takes technology, AI, application, algorithm, when they take it and what they do with it, that practices are not standardized. So that human variation is the biggest variation that we see, and that happens at the AI adoption stage. So that's why we need to be cognizant of that and really increase our capacity as we're gonna, and GI world, ingest these technologies. Um, but as we went forward with Valid AI community, some things became very apparent to us. I did this survey around a year ago at our annual anniversary, and I think a lot of health systems, now, of course, you as individual researchers, scientists will be facing the same challenge to some degree. In fact, people don't know where to start, right? Do you start at Gemini? Do you go to OpenAI? You know, and do you straight away go there? You go to applied products which are there. So there's a real, and this picture is LLM jungle. So truly, it's a jungle out there, and the jungle is getting exponentially worse. So we need a navigation out of this LLM jungle. But while the left jungle was done by technologists, the right jungle is done by clinicians. What I showed is a mind map of all the use cases which are in the PubMed literature of generative AI. So my team looks at that and then maps them, and it's a eye candy. The reason it's eye candy is there's so many use cases. Now, if there's so many use cases, which use case you start with, right? And I'll give some reading glasses for people who really want to go through all of that. But the idea is that there's so many use cases that you can't make sense of it. It's not one person job or one organization job. Uh, and the second bottleneck we face is, once you identify where you want to bet on, which algorithm or which Gen AI product, which use case, how do you bring it in a safe and secure manner? I was looking from the lens of enterprise, where I was also responsible for maintaining the cybersecurity, compliance, privacy, and equity. So, in a research based setting, in a non production environment, you can bring tools and you can play with it. But how do you make sure their ethics, if you're bringing it enterprise wide, then not a single employee will actually do wrong things with it? Like, I'll just trust the data. So, there's a lot of heavy lifting we have to do in our capacity, including AI literacy. So it became very apparent to us that most of the health systems, and I would also include Stanford and Mayo in that, because while Stanford and Mayo are investing huge amount of money investment into it, and there's a huge competence there, there's still a lot of physicians, a lot of researchers who are lagging behind because it's not universality the way the AI literacy has happened. So there's a lack of talent to really bring it across the ecosystem. There's a lot of compliance burden that's increasing the cost of implementing technology that's not been told in the language of the large language models. And then the maturity of us in AI is low. So, so we kind of felt there's a need for a glue. Now, Validate was a program. A lot of health systems started asking for execution support, and we could not, as a program, as an academic program, do an execution support, launch a cloud, launch a whole platform for other health system. So we felt there's need for a glue, there's need for a middle ecosystem layer which will support all the centers who want to convert or enable AI centers for excellence. So that's how GenServe has been formed as a new co, but it is led by founding health systems and founding health partners, so we are able to support inside out transformation. And we are looking at what is the least common denominator thing that needs to be common across all health systems and health plans and pharma. Let's bring that core set of technology competency. Let's bring the core set of personal human talent competency so we can empower all in this, what we call as innovation to transformation journey. And kind of, I also give an example of, and I'm in West Coast, so I'm standing in front of ocean, and you're thirsty, right? You see all this amazing innovation happening, and you have thirst, but you can't drink a single drop of water from the ocean because that innovation, that knowledge, is not the right for us or our patients. It has to be processed, desalinated, then it is ready. And that's the journey for transformation that we have to do that OpenAI will not do, right? This is kind of the capability map if you look at across organizations that needs to happen. So we benchmarked across 7 pillars, um, and part of that is in a very mini smaller way. You can also think of your research team having this capability in some maturity assessment. First of all, is you need to have a strategy for your organization because AI may help influence that strategy, but it starts with your gaps in your strategy. And then you also need to have external environmental scan, which all of you are looking at daily, the technologies that are coming, because that allows us what is possible. But you then need, as you know, where you want to go and you have an idea what is possible, you also need a governance layer. What you're not going to do, which is too risky for you, what is okay for you to do based on your policies and risk tolerance and security and compliance. And once you go through that, you need to know which people are going to help execute on that, which people are going to help monitor that, which are going to leading that, right? And that you can increase all these capacities, but that's kind of a flow. And you have that, then you also need tools for managing your data foundation, the ultimate currency. And I know Piyush shared so many of data assets, but you have amazing data asset which is within your health system. And that is like amazing asset, but is mostly locked. Many of the, even we have 10 people, 15 people data scientist team, an average clinician, an average researcher struggles every single time to get the data from their own enterprise. And I hope before I retire, we'll be able to solve this problem, that there should be 0 degree of separation between data and what anyone needs. I think that is what we should all aim for, and that's definitely what GenServe is aiming for. Um, but once you have the data, you also need to know how to execute on the data. Do you have the right ontology? Do you enable the AI in the right way within EHR, within workflow to deliver it? And how do you manage all those assets, monitor them, drifting and other kind of things, so we're not causing unintentional harm? So we have actually a survey which people can do, and we assess them on maturity level. That's the starting point for GenServe. We provide an assessment. We get, hey, your organization is at this level right now, but then let's together to kind of improve it within a year. Can we improve the maturity of this AI center for excellence? And few things that we've learned through this journey is this certain set of technology platforms as well as products should be the base foundation as you kind of think of bringing AI center of excellence for your enterprise, right? One of the things we realized is many people, if you're an independent researcher, how many large language models you're going to buy, and really services you're going to buy if you have to do validation, and then you may do API calls, but your team may not be familiar with API calls. So you may do tooling, but how about we provide enterprise wide tooling at scale, right? So your 50 people, 5 labs can just straight away go on it and can compare multiple LLM models. They can upload the RAG documents which they want. They can do the prompt engineering, and they can get the output in a manner. So we've created a very secure, trusted, what we call as a LLM workbench. And not only for researchers, we actually created for every single employee in the health system. And the reason we have done is, in the age of AI, our philosophy is we're going to be betting on human capital. We're already spending $100,000 for an average healthcare employee. If by giving them a tool which is less than $100 a year, we can bring their AI literacy level to this much, then that's an amazing level of value that we can unlock. So researchers, it's rule-based control, role-based control. So researchers will have researcher data access, clinicians will have a clinician wide access, employees will have different kind of an access, but completely customizable in that regard. But this is also mapped to enterprise assets, data assets. So if there are de-identified data, if there's synthetic data within the health system, or the health systems provide other kind of negotiated data arrangements, they can provide this data right here, and you can chat with the data. So once you master, and it has inbuilt capability, and if there's a time, I'll be happy to demo this platform live to you. There's an inbuilt capability to create no code AI assistant. So you can do projects across teams. So if you have 15 people team research, you can throw on a project right there, share with them data assets, and they can all work together in the LLM environment. We're working closely with Dr. Mathur to add a module of what BrainX community has really done amazing work with Humanly as well as Gamely. So we want to add those modules courtesy of BrainX community, so people can actually use them right when they are playing with these data. They can really have right on their hands Humanly framework to evaluate those models as well. And this speaks to the strength of the partnership. Now, as people gain AI assistants, they are comfortable with LLMs while at work, safe, secured, and they upskill themselves, whether it's writing grants, whether it is doing data analysis, whether it is writing HR reports or anything else, marketing and all. Then the next stage comes. And that next stage is agentic autonomy. So we are building clinical agentic modules then. We have a clinical graph engine on the data, and that will launch agentic module. It's been a 1 year way of planning it. We feel if we just bring on agentic modules, people get too confused. Oh, what is this agent doing? Where is the data going? There's no AI human-based workflow. That's creating more divisiveness within the health system, and more resistance to AI, because AI is doing the work like agent. Would my job stay or not stay? So what we are doing is enabling the human AI workflows first, empowering humans, and then they decide which of those repeatable tasks they are doing through AI assistants can then be done through AI agents. And so we are giving humans the capability to prescribe agents, and the agents do the work. And I'll give some examples of that as we go forward. Agents do the work, and the data come back to the humans for the check, and then they can decide, hey, that's the next best step, and let's go further. And our goal is to really convert. The bigger vision is to convert AI, which is right now a cost center. Um, can we convert into revenue generation center? Can we create so much value that the cost of implementing AI is hidden within that revenue generation? And it's a no-brainer that you have to go. It creates a flywheel effect. And we already identifying a lot of use cases with our partnering health system, which will allow us get into that revenue generation goal. So just few more slides in that part. This is kind of a so we have multiple medical LLMs and non-medical LLMs as well. John Snow Labs, we have partnered to have their LLMs as well. And so we have around 15, 20 LLMs that you can use right out of the bat. within one platform. You can create completely HIPAA, completely secure, completely production ready. So even if you put identifiable patient information, identifiable data about you, that's only going to be logged with the enterprise. It's not going to go to train the model in that regard. But we also allow this platform to be accessible not only through a Mac DMG file or a Windows exe file. It also has a Chrome browser add-on and others. So the goal is your research community or your clinician community can access it in whichever way it wants. And that gets an immediate value from a CIO, CFO, chief compliance officer perspective, where we decrease the leak to public LLM, which is $1 million penalty, as you know, with a HIPAA violation. So it secures that, but also we start enabling everyone through AI literacy by giving them real tools. So if we just train people on AI literacy, it's a shallow training because they don't have anywhere to experiment. So really, it's experiential training when you give a platform to them to play. Then really the value comes and earns itself. These are some of the agentic modules that we believe are gonna create with our clinical graph engine a lot of value. And then we provide a whole set of services really to enable anyone, a small health system to a federally qualified health system, to be Mayo Clinic like, to have the full services, full engine to support which only leading health systems can provide. So that's our goal, to empower every single healthcare organization, rural, federally qualified health center, underserved, um, but provide this full breadth of capability. They can really take full advantage of AI services, including a central monitoring command center, which will monitor at scale model drift and other things that are happening across the different enterprise AI applications that you have in your portfolio. We are also coming within Epic in that regard. So you can chat with the data real time. And then we've already mapped a lot of the use cases. Now, what I was showing you early eye candy diagram, which you were squinting to read, we have now deconstructed that into a prism diagram, which is maps all the use cases from value and feasibility. Because not only you want high value cases, you want cases which are feasible at this time. So if you look at the tip of the prism, that's where high value, high use cases are. Ambient scribe is already becoming like a water in US. We do believe automation of patient care navigation is gonna become one of those things in the very near future as well. So I think the goal is getting a singular set of platform, providing core capability to humans to be humans in the workflow, then unlocking agentic workflow provides a very structured, standardized approach for organizations to move from a very low maturity level of AI center of excellence to really achieve repeatable, replicable, highly reliable care that has never been possible before in the human world. Just some of the things we are doing is we are trying to make for founding health systems a very easy to actually have cost savings. So actually, so they are able to join forces. We want to walk this path collectively, and we want this to be a founding health systems led initiative. And basically, our goal is to decrease the cost by 5x, increase the speed by 10x. If you are doing amazing stuff, creating new things, we love to talk with you and we can embed those modules right within it, right within the platform. So in a way, we are creating a Switzerland-like approach to really empower innovators who are creating new tools and builders to disseminate their part. This is our team. You will see some of the many of the folks on the right side, leading people from Coalition of Healthcare AI, train and valid AI members. And I will wanted to leave enough room for Q&A as well. But just want to leave, you can email me atreja@gmail.com, my last name atreja@gmail.com, or partner at GenServe.AI. Just if you want to engage, learn. We have two models of engagement. One will be working with BrainX to unlock as well. One is our traditional health system implementation science partners, where we implement technologies at scale and transform health systems. We also have R&D partnership, like we have with BrainX community. We have R&D partnership with Applied AI Center. I'm just trying to see with the National Science Foundation, with 4 universities, including Georgia Tech, University of Florida, Tulane, as well as University of Louisiana, Lafayette. And we're exploring, and we'll explore that with BrainX community. Can we have an academic license to researchers, where they can create value from it and create new modules and publish at scale? So we maybe, if things are relevant and based on your feedback, actually, that's a great, the BrainX community feedback. If you want, we can unlock an academic license, which is non-enterprise, but available to individual researchers to unlock value. So I'll pause here and open for any questions that you have. And we see this as a start of a journey. And I have personally felt strongly enough that I feel this is one way of transforming multiple organizations and maybe multiple countries globally. And this is also creating a, I would say, a glue to allow me to meet many of my friends and do work together, which had not been possible without you set up this matrix on organization to support it. So really excited about what's lying ahead. I want to pause here and just give it back to Dr. Mathur and open up the Q&A session.
Yeah, thank you, Ashish. And you can actually leave that slide up there so that people can capture that information. But thank you for working on this, because I do feel that there's a huge implementation gap, that needs to be addressed, and it needs to be addressed in a platform approach. Because what we have seen in my experience with AI and healthcare in the past, we have been essentially using these narrow network approach for application. Every time we are trying to build these neural networks or some other AI models and apply them one at a time, piecemeal, and it's very, very frustrating. It's very time consuming. It's very inefficient. A lot of them fail, and it just takes a lot of cost and resources for something like this. We had actually done a session previously with some of the leading AI platforms from radiology, learning from their experience, because they have a unified data space and they have a unified application space. So it's much easier in many
Mm.
ways from that, because you're going from PACS, which is a unified area where they're capturing everything, and then you have a EHR where they might be reporting things. So it's limited. But when you think about a health system, it becomes very diverse, very heterogeneous, and it's a much more challenging space. And of course, everybody is extremely excited about generative AI and its applications. And just like you very well demonstrated, that jungle you can easily get lost in. And that jungle is also evolving so fast, because it's not like Amazon, which has stayed static in many ways over time period. This, like, every time you go there, you find a new tree, right? And that's what you were trying to show. There's a new LLM, there's a new framework for deployment. There is a new agent methodology. There is some new deployment solution that has come in. I haven't seen this rapid pace of AI development in years together. And of course, that humbly, that's been in a limited, a short time span of my involvement with AI and all. But also, I think one of the things that you addressed was many people are thinking about, like, this generative AI solutions for clinicians. That's a common thought. But this approach, your approach, is to empower everyone, right?
That's
And
correct.
I was just reading an article just today which talked about 15.6 hours spent by clinicians on different administrative tasks.
Mm.
So these are like non-clinical administrative tasks. Now, it might be about writing an email. It might be about, taking care of some billing issue. It might be taking care of creating a PowerPoint. We really need to decrease that time, because nowadays, with the use of generative AI, it's an enabler. It's not necessarily going to do everything by itself, but it's an enabler, and that 15.6 hours can be shrunk pretty significantly. And the burnout issue is real. Like, people have to go home and still work on some of these administrative tasks. So if you can shorten that time period, it saves people time to focus, clinicians to focus, administrative workers to focus on the task at hand, but also have time for themselves to grow and not get burnt out. So I am sure many will appreciate this platform, which provides a generalized approach rather than a narrow approach which is directed just towards a clinical task or enabling just recognition. The other thing that I found interesting, again sharing some data over here, per clinician, depending upon which data you look at, 3.6 to around 8 administrative workers
Mm.
support that clinician for an organization.
Yep.
So if you think about all the people in revenue cycle management, all the people, even people who are helping with patient transportation, with supply chains, all these different tasks, there is a lot of administrative support that is required. So if you have a platform which is very narrow, just towards directed towards clinicians, you're missing out on a
Mm.
much, much larger opportunity. So again, I think that way, having a platform like this, which is broad, which enables the entire, just like you very well said, the human capital at the healthcare organization, ultimately helps the clinicians too, ultimately helps the patients who are at the top of who we need to serve. So just some thoughts that I was capturing from your talk. And really, I mean, we have a small group, so open to any questions or comments from any of the participants over here.
Thank you, Piyush. Very
Yeah,
well
feel
said.
free to unmute or feel free to put it in the chat too.
Hey everyone, this is Gagan here. I think I'm very new to all of this, kind of struggling to kind of understand and make sense of the whole AI world. And thanks for a great talk. At least gives me a pretty broad concepts, Ashish. I can see your vision. I think this is great that you're doing for the whole healthcare and not only for just kind of limited to a small aspect of the whole um, patient care. Patient care is not just doctors, it's nurses, technicians, pharmacists, administration, scheduling, as you said, like, colonoscopy preparation. There's so many aspects, and I think that is just great. It is like it's mind-boggling. I'm an ICU doctor, so I mean, and I can see how I can kind of use some of it, and yeah, and thanks for introducing me to the BrainX. I think I'm going to look into this community and see I can be active participant of this group and see if I can come up with uh, help and be help, from you guys just to kind of get some of these things streamlined. So yeah, I'm really happy to work with you guys. Ashish, great talk. I have kind of took some screenshots just to kind of go into the things more into more details. And if I have any questions, I'll certainly call you. And Dr. Mathur, you know, I like to be in touch with you as well. And
Sure,
just
absolutely. Absolutely. No, we are all learning because if you think about 2022 November is when ChatGPT came, right? Prior to that, our research team was already working on the precursors of ChatGPT, but that was a pivotal moment. So if you think about that, and now it's November 2025, it's just been 3 years. So even if you're starting now, we are not that far in the scheme of things, and the things are the tools, the models, everything are evolving so fast that some of those that came in 2022 or early 2023, people are not even using them anymore. So anytime you get started, I think it's a start. That's why when I show BrainX, Ashish was asking me like, why the big logo of the brain over there? I said like the brain represents the human brain. If you bring everybody together, and the reason why I have zeros and ones behind it doesn't matter whether you're starting with zero or you're starting with one, we are all in it together. And it has value. Both zeros and one in computational space have equal value, right, Ashish?
That is
So,
absolutely
so, so,
true.
so that's why, together we have the human brain capacity, which is unmatched. There is still no AGI, so as to speak. The human intelligence is still the most important valuable asset that is there, and it doesn't matter whether you're starting from zero or one. You have the same value to production. So, thank you, Gagan. I do see Dr. Mishra raised his hand. So, questions or thoughts from you?
Hi. So I got interested in this talk because I saw the brain over there, and I have a basic degree of being a neurosurgeon. So I thought it's something to do with neurosurgery, but it does interest me a lot because I got bitten by an AI bug earlier this year, and it became very virulent on me. So I left neurosurgery and started a company known as Care Fusion AI. And what we do is what could help Ashish a lot. We basically building a team of doctors and engineers, both over here in the United States and the United Kingdom, Dubai and India. Most of our technical team is in India. And we're basically building very simple scheduling, initial intake, and clinical and nurse and doctor's AI agent. And to answer your question on colonoscopy, I do have an agent who gives the pre and post instructions to the patient for colonoscopy, and it does a better job than your nurse or you would do, unfortunately, in giving them what preparation they need and what they need to do before and after. So we are creating these set of agents which are going to be low liability issues or zero liability, giving these scheduling. You're calling a doctor's office in Canada or in Hindi or English or Spanish, anywhere in the world, on 25th of December when everybody is enjoying Christmas, you can still call the doctor's office to set an appointment. We interface our agents with any existing systems where you have, and you can get whatever you want, whenever you want, and it will help you. And if you are not happy, it will transfer you to a live agent. So I just wanted to introduce myself, tell you all we are not doing as hi-fi stuff as you all are doing. We're just creating simple, basic agentic AI agents to communicate with your patient group, to set an appointment, to give a colonoscopy instruction. They go home and they have fever and they have pooping like mad. They can call the post colonoscopy agent and he will give you what to do. And if he's not happy, he will connect you to a doctor. So I thought I'd introduce myself, tell what you're doing, and congratulate you on what superb job you all are doing.
Yeah,
Thank
thank
you
you,
so
Dr.
much.
Mitra. That sounds very, very exciting, and happy to connect with you and learn more, and maybe possibly feature you at one of our future events too. But isn't this amazing? So we are all doctors. There is a common glue called generative AI, and then a neurosurgeon leads the development of a colonoscopy agent. Right. So that's the power of generative AI. So it crosses all dimensions. It doesn't matter, and that's the excitement over here that we are trying to capture too. But I think there's a lot more work that needs to go in there too. So Ashish, I did have a question about you talked about governance enablement. A lot of organizations struggle with that. So how does GenServe help with uh, enabling organizations create a secure governance structure so that they can have this platform deployment? Because people I've seen spend like months together or years together in setting up some kind of a governance solution, whereas this could be an accelerator for that too, right?
That is correct. So I think the governance structure has two components in general. One is the playbook, we call it, which is the procedures, the processes, the tracking of all the stuff. And so actually, our partnership with ServiceNow allows that as well. So we can have a portfolio of all the AI initiatives happening across the enterprise mapped into one common repository, for lack of a better word. And that's linked by project management tools and tracking in that regard. So there's a playbook on, but it also playbook goes deeper than that. It also tells, if it is generative AI, then you need to use this to evaluate. If it is predictive AI, then you need to use these kind of the model cards and other things to evaluate. So you create a whole playbook to guide people what is the policy, the procedure, as well as a tracking kind of a tool to have that. But the other part of governance is also, while people may call it soft skill, it's actually the most important part of the skill is, how do you prioritize, right? Because there's so many use cases gonna come. So in fact, today what we are presenting is leveraging the return on health framework from AMA, American Medical Association. So you can prioritize that. And we show the example of how you can use it for structured equation and really distinguish, prioritize the use cases in the top buckets. So we took 35 use cases, Gen AI, found 10 of them most common one, use this framework in top three, which were like AI Scribe, generative AI enterprise wide, as well. And and the bots for triage came much more lower in that regard. So I think so. Think of from a health system perspective, there'll be so many requests coming, either from vendors or from inside. You need a layer to filter those, prioritize them. Then you need a layer to actually implement them, assign resources, get approval, then implement them, integrate them. Then you need a layer of monitoring. And then you also need a layer when you're bringing something new. What we do not go is take something old out. So we also need to say when you're bringing a new solution in that regard, what all solutions, existing processes have to be changed, existing solutions have to be redefined in some degree that allows an end-to-end capability. So there's a lot of knowledge gaps there people have. There's a lot of technology gaps people have. And I think there's a lot of tracking and monitoring gap people have. So that comes under the capability of AI Center of Excellence in a box.
Yeah, that's great. So I think you talked about strategy. Frank Pepe and I published a book earlier in the year. We are actually working on putting out the second version for that, for strategy for AI and healthcare, and we talk a lot about some of these strategies in that book. But how does one get started? So you did put in this contact information. I'm sure there are people who want to know, how can I get this GenServe at my place implemented, so that I can use the tools that are provided through this, or so that I can have this conversation with my CIO, or maybe I can tell my friend about this. So what's the next step that people need to take to reach out through this email, or how do
That's
they?
correct. That is correct. I think the easiest way is go to our website. There's an interest form you can fill, GenServe, GenServe.ai, and contact us form is there. Or just email partner@genserve.ai. It's even more reliable than my email because our team watches it like a hawk and you'll get a response.
Is it a team or an agent that takes care of it?
Right now, it's a team. Human in the loop, full human in the loop. Will ultimately have an agent as well as we validate. And one of the things is when you shoot an email, please tell us who you are, your organization. Are you looking at enterprise wide? Or are you looking at a research capacity or academic? So we can kind of line up the right kind of resources and tools for you. And in any way, if you want to just partner, be part of evaluation team working with BrainX, which you work closely, the Center for Excellence Health Systems will also be made available to do file grants together. ARPA-H to NIH, doing a lot of ecosystem work together. So I think it'll be great to have folks as part of the community as we're growing it.
That's great. So again, if you're trying to do something with generative AI, trying to get a single solution like ChatGPT implemented, or trying to get, say, Perplexity or Claude or something, you're going to try to approach that piecemeal. So instead of that, I think the best approach is take the platform approach, so that you can pick and choose the tools you want through that. It can help you do multiple tasks that way, because it's a platform that serves you well for different tasks. You're not worried about the security either of your data from the non-clinical data, which might be important to secure to, versus the clinical data. Everything resides within the platform, and you're not worried about building individual security layers. So I think this is a great initiative, and thank you, Ashish, for sharing this. I think we're gonna stop at this. Thank you, everyone, for joining us. And until next time, we will stay tuned. Please follow us on brainxai.org or brainxcommunity.com. A lot of resources over there. Please subscribe our YouTube channel, or join us on LinkedIn, or join us through our newsletter. Thank you, everyone, for joining us. Take care. Bye.
Thank you so much.
Thank you, Ashish. Thank you, everyone.
I
My
thank
pleasure.
you.
Bye,
Thank you.
all.